Hello and welcome to Health Talk. I'm Dr. Sanara Kumar, sitting in for Dr. Manny. Life can take a real toll on your skin. Stress, aging, even the weather can affect your healthy glow. Joining me now to help us figure out what's important for healthy skin at every age is dermatologist Dr. Jody Levine. So let's talk about what to expect at every age. How about starting off in your 20s?
Well, in your 20s, your skin looks healthy. People in their 20s have good-looking, healthy skin, very little sun damage. The problem is 20-year-olds forget to use sunscreen. You have to remember the sun at 20 will affect you later in life.
And what sunscreen should we be using?
Broad-spectrum sunscreen. I recommend in every age group an antioxidant, a sunscreen, and a retinoid.
Does it matter what the SPF is?
Minimum of 30.
Okay. And what about the UVA and UVB? Does that really matter?
It does matter. Broad spectrum means it has UVA and UVB coverage. The UVB rays cause burning, but the UVA rays cause long-term skin damage and melanoma.
Okay, do we have to worry about still dealing with acne when we're in our 20s?
Yes, many 20-year-olds are still tackling acne. And I adjust the skincare regimen as needed for people with acne, but people throughout the years deal with acne. It is not just a teenage thing. Adult acne is becoming more and more common.
And what can we use to really treat it? And is the acne that we're dealing with in our 20s different than what we're dealing with in our teens?
It's really, acne is worse in your teens. The hormones are higher and you have more cysts and more active lesions. But acne continues through the ages, and what you use really depends on how active the acne is and how deep those pimples are.
Okay, so let's move it up to the 30s now. What can we expect in the 30s?
Well, the 30s are the humbling years. Those are the years we begin to see wrinkles, especially with facial expressions. You also begin to notice the sun damage more and the folds get deeper. So people in their 30s actually begin Botox and fillers. They begin to get glycolic peels and sometimes laser procedures.
Can you get resistant to Botox? I mean, if we start using it in our 30s, is it going to be effective later on as well?
It's a good question. You can't get resistant to Botox, and I actually recommend using it prophylactically to prevent wrinkles from coming, because the more you relax the muscles, the less wrinkles are going to form.
What about what we can do to help our skin in the 30s?
So in the 30s, again, I recommend an antioxidant, a sunscreen, and a retinoid. I stress the retinoids at this stage because they help reverse the visible signs of skin aging.
Okay. And what about the 40s? Should we really be nervous about facing our 40s?
We shouldn't be nervous about anything. But the 40s, the skin begins to lose firmness and elasticity. You begin to get more wrinkles even when you're not making facial expressions, just at rest. The folds get deeper, and you begin to lose some volume in your face.
And what can we use in our 40s to help us bring out the best glow that we have?
Well, I recommend monthly glycolic peels to help with the glow. The 40s should continue the staples, the antioxidant, the sunscreen, and the retinoid. Sometimes you need to add a moisturizer and some firming creams like peptide creams.
Now, a lot of women in their 40s complain about getting a redness through their face. What's that all about, and what can they do to treat that?
A lot of red spots and brown spots are the result of the sun. And you get broken blood vessels from the sun. A lot of creams make claims that they can help redness, but unfortunately, I haven't seen any that are very successful. Good cover-up and laser treatment for redness.
Is there a medical issue in regards to the redness that they may need to have it checked out by a dermatologist, or is this something that you routinely find in your 40s?
Well, I think it's good to get anything new checked out because there are certain skin cancers that can present as red lesions. Rosacea is a medical condition that gives redness, but it is known to happen that you will get increased redness with time.
Okay, good. All right, now the 50s. How bad are they?
Well, in the 50s, you definitely see more sagging, more jowling, an increase in loss of volume, and this is the age when most people, or many people, consider surgical intervention, a neck lift, a facelift, brow lift, other eye surgery, and all these procedures get complemented by Botox, fillers, laser procedures.
How does menopause change our skin then?
Menopause causes a drying of the skin. So people in the 50s tend to back off on the heavy retinoids and use lighter ones. They also use more moisturizing creams to help with the dryness.
And that's because we're losing oils by going through menopause, because we're losing our estrogen levels are lower, correct?
Correct. And even in men, older skin gets thinner, and thinner skin is more likely to dry out.
Okay, good. And so at any age I mean, what's the most helpful tip that you have for anybody facing any age right now that they're at?
My most helpful tip is sunscreen. The sun is the primary cause of premature skin aging and skin cancer. So if you protect your skin from the sun, you're more likely to have healthy skin.
All right. Well, thanks so much for joining us today, Dr. Levine.
Thank you.
It's been very helpful, very informative. And if you have any health topic you want to talk about, send an email to drmanny@foxnews.com. Until next time, I'm Dr. Sanara Kumar.